Hello again, everyone. Mark Hack, Macomb County Executive. John Paul Rea, Deputy Executive here in Macomb County. Updates on what's going on with the COVID crisis here, specifically in Macomb County. And John Paul, where are we at with the numbers today?
Mark, our updated community dashboard illustrates that currently right now we've got 3,423 cases countywide and unfortunately 281 deaths. Statewide, the numbers continue to rise quite drastically, but 25,000 cases now statewide, just teetering towards 26,000, and we have now plateaued over 1,600 deaths statewide right now.
In comparison to what's going on with other counties, and again, I keep reminding everyone, Wayne, Oakland, Macomb are the top 20 counties, in the top 20, if you will, with the number of cases being reported, which is pretty staggering. But fortunately, our numbers are still being somewhat contained. And I think a lot of it is because people are following a lot of these CDC recommendations. They're also adhering to the governor's orders, dealing with the stay home, stay safe order that she has in play. And keeping, I guess, if you will, that peak down and the numbers in our hospitals. In fact, our hospitals are not really as worried about that surge right now because people are starting to take on that social responsibility of paying attention.
Mark, you're absolutely right. We've been a bit more fortunate here in Macomb County, not only with regards to the number of cases and deaths, also with regards to the capacity and surge in our hospital system. So as we've been working not only with our health department to ensure that we're following all the guidelines and recommendations coming down from the CDC, following the stay home, stay safe orders, ensuring we support those critical infrastructure companies. Those are the things that are happening across this county which have been able to stem this tide of the virus. We're still looking at this from a long-term perspective, what this looks like through the end of April here with the stay home, stay safe order, but ultimately what other safeguards we can put in place to protect our community and following all those federal and state partners.
And it's interesting when you're talking about balancing that, health and wellness of people, especially with this particular virus and the concerns with it, and the number of deaths really are compelling. With the business aspect of it and the economy, it's starting to get a little bit more tense, and we're hearing it. You've got the President of the United States trying to force this opening of business here in the United States, and you kind of understand that, but still, all the health experts are saying you need to comply. You need to realize this is going to be a longer-term effect, and if you start going back to the way we were, there's a potential for this, I guess, peaking again. That might take place. So. We're concerned about that. We do believe it's more of a state-by-state requirement, and we need to be unified on that. Whatever we're doing, we need to do it as a state. You can't have different communities or counties going off doing something different, and especially when it comes to the enforcement aspect of some of these orders and/or ordinances, health ordinances. And I say that for the reasons that if they realize the shelter in place means you can't go out on a motorized boat. Like it or dislike it, at least there's somebody out there that has the ability to enforce that. The DNR, the Sheriff's Department, they can stop you and make sure that you're not doing these things. Even some of the sales in the stores, the grocery stores, cordoning off certain areas because those are non-essential items. Whether we like it or not, it's still an order based upon the governor's order, and there is a compliance factor that comes into play and somebody who can enforce that. And recently there was a question about something that happened in Oakland County. This order to try to tell businesses that they have to have their employees wear masks under a health order. I don't know that's enforceable. Again, I look at our health department, talking to our health director, it is a CDC guideline that you recommend. People, even in our environment here within the county government, we're recommending them to wear the masks. People are complying. We're starting to see that. We realize that. But when you put an enforcement aspect to it, and you're not able to enforce it, it really is no different than a recommendation. So the recommendation is already in place throughout the state, but people are calling us saying, are you going to make this order for small businesses and people to force their employees to wear it? There's no way possible the health department can enforce that. And my background in law enforcement, I always said that. If you're not going to be able to enforce something, don't make it a law, because then you really got some problems and a conflict for the public or for society. So here in Macomb County, we're fortunate. People are adhering to those social distancing, the rules and the guidelines from the CDC. We're going to continue to move in that direction, and if it becomes something that the state decides that they want to require and figure out how do they impose the enforcement capabilities to that order, then obviously Macomb County will be under that very same order. But in the meantime, just going off haphazard, I think it creates that confusion, and there's not that united front, and that's what we need to stay focused on, is being united as a state right now, and for that much even as a country. So we're not going to be doing that because our health department is saying we can't enforce that, and I don't believe they can even enforce it in Oakland County with their staff, because our health departments are absolutely inundated with the work they're doing of trying to figure out how do they not only understand the numbers but respond to those that are affected by this. And so it's very challenging to even think about putting something in as an order.
Mark, I think challenging is the best word to use. It's response and resources right now, and while others are looking at their numbers and we're trying to get a better handle on what's happening here in Macomb County, it's understanding that whether we go through our regional partners, our statewide partners, or federal partners, that those resources and those response efforts are coordinated, as you highlighted. That's going to have the greatest impact, that's going to have the greatest outcome, and that's going to ensure that the spread of the virus doesn't continue to keep rising.
Yeah, and we get it. I mean, obviously everybody's tense right now. There's an incredible amount of attention drawn to this particular issue, but as they start to go on and hearing the numbers again, people are now moving in a different direction. How do we force compliance, and how do we get people to do things different? It's a very delicate balance. So with that being said, we're fortunate because masks seem to be the number one concern people are having. How do we get masks, whether it's to our employees at our business, county as a government, first responders, as well as our healthcare workers first and foremost. The N95 mask seems to be the ones that most people are, I guess if you will, the first responders healthcare are very much interested in. And here we had a donation given to us without even requesting from DTE. And they promised us 30,000 of these masks, delivered 15,000 last week. And then just recently, we went over to our warehouse to accept their other delivery of the other 15,000. So they came good with that promise and that donation. So we can't thank the folks enough from DTE for that donation to help our first responders and our healthcare professionals here in Macomb County.
Mark, here in the county, statewide, corporate champions have been standing up and actually responding to this. Whether it's getting some of that personal protection equipment, whether it's scaling up an operation to help out a need in healthcare, or whether it's looking at other type of community response or need. These folks are coming out all over the place. A great regional and statewide partner in DTE being an absolute champion in this arena, and very much want to thank them for the generous contribution and how we can ensure that those masks get to the greatest need in our community.
Here we are. We're getting a tremendous amount of response, whether it's from churches, from other organizations, even the purchases we're making from the county for masks. There's a lot of people stepping up and being very helpful. The schools, what they did.
Absolutely.
With personal protection equipment. But with that being said, right now we know the effect is always the health concern that we have first and foremost. But with that, the economy, as I mentioned earlier, and what's going on with businesses. But there are some plans to try to figure out how do we help businesses in the interim here to try to sustain that, so that when this does come back, we still have those businesses that we've been able to rely upon here in Macomb County, Southeast Michigan, and throughout the state. And I understand there's some programs that we have right now that we're trying to get them some help and assistance. Yeah,
Mark, our small business relief program, which is being administered by our Planning and Economic Development Department. The county received a grant from the state of Michigan, $800,000. We're able to get a generous contribution through First State Bank and other contributions through a consortium of partners, which included the Community College, the Intermediate School District, the Sterling Chamber, and the Macomb County Chamber. We have over $930,000 that's going to be going out to 148 businesses across the county. These are businesses that were impacted by the Stay Home, Stay Safe order, the other executive orders with regards to bars, restaurants, and other service-based industries. And while there is so much more demand out there, Mark, this is at least an injection that will ensure that these businesses will have a little bit of deep breath here and be able to figure out how they can sustain their operations and figure out when we start to scale back and kickstart our economy.
So for more information on it, macombgov.org.
macombgov.org, and the small business relief tabs are there. There'll be other rolling programs that currently Vicki Rad and the team in planning are working on right now, getting them with information from even the Small Business Administration and other programs coming out of the Unemployment Insurance Agency at the state of Michigan too. So a lot of programs all going to support businesses. Go to macombgov.org, get that preliminary information, see if your business qualifies, and then we have folks standing by that will be able to help direct you and navigate you through the process.
Very good. And later today, our final point is the Board of Commissioners are going to be voting on the extension of our emergency order we enacted March 13th here in Macomb County. Obviously, it extended through April 17th, but they're going to be acting on it sooner. Hopefully get another 60-day extension. If they decide to cut that short, that's up to them, but we don't believe this is going to be a short-term issue. We know it's going to be long-term, and I say that for this reason. If you think about the entire country, the United States declared a state of emergency. The state of Michigan declared a state of emergency. The county declared a state of emergency. With that being said, the state and the federal government has declared a natural disaster within the entire country, as well as the governor of the state of Michigan. And talking to emergency manager folks, in my experience, I have never seen where that declaration was, on the same time frame, where you actually have a disaster declaration and this emergency declaration, state of emergency, at the same time going on. So there's no question. My point is, here in Macomb County, we still have that severity of concerns here. And so with that, we anticipate the Board Commissioner overwhelmingly supporting the extension of this emergency declaration here.
Mark, as we've highlighted, unprecedented times. These are arenas and areas we never thought that we would have to ramp up, whether it's staff support, whether it's coordination around the community, or whether it's leveraging a number of these different emergency statutes that are in place. We are assessing them, we are responding to them, and we're bringing to the Board of Commissioners a request to not only extend this to ensure that we can respond and help serve the community in these very trying times.
And so as we continue to try to get ahead of this, manage some of the issues concerning the COVID crisis, we offer once again for folks to log into macombgov.org for a tremendous amount of information, even as John Paul was just mentioning earlier here, talking about the business aspect of it, what you can do, connections to try to figure out food sources or resources that might be available, and truly understand the numbers that we have going on. So once again, we thank you for joining us and continue to remind you to stay safe.